So now let's look at the last chamber or the inner compartment, which should have sterilized items. These items should be sterilized and packaged before placing them there. So we have a kidney dish for wound dressing, for a whole lot of things that should be sterile procedures. Then you need a kidney dish. Then we have a forceps. Can be any type of forceps, but you must have at least dressing forceps, dissecting forceps, and you should also have sterile scissors. Packed, it should be sterilized and packaged. You have sterile gauze and sterile cotton to be used when necessary. Also packaged neatly after taking it from the CSSD. Yes, this is also a sterile cotton that you may need. CSSD is Central Sterilization and Supply Department. This is a crib bandage. I don't know why you would need a sterile crib bandage, but if it's sterile, then you put it in that compartment. This is a gallipot. Yes, a gallipot should be sterile for use. So those are the items there. Any other item that you think should be placed there, you can add it to my comment section so that all other people can learn. So when you are done with all your things, okay, let's see what is left there. The sterile scissors, I have already mentioned that you need a sterile scissors. So when you are done with everything, you have to pack them. You pack them into the various compartments. Then when you get to the facility or to your house, you go and decontaminate and sterilize appropriately. The other thing that you carry in a different bag is the weighing scale. Yes, that one you don't put it inside your home visits bag, but you carry it along. The client will stand on it to assess the scale. This one, all clients, you have to assess the scale because you need it for your care plan. Even babies, if you don't have the hanging one, then you make the guardian or the parent carry the baby, and you weigh and subtract the guardian's weight from it. So the items, after everything, you pack them back, and contaminated ones you pack them into a rubber. So when you get to your facility or the house, you decontaminate appropriately and sterilize the ones that should be sterile. Then you make your bag ready for next use. When you are done with everything, you are done with the visit for a particular client, then you have to wash your hands again. Yes, the same technique, you have to wash your hands. Let's watch how he does it. You have to do proper hand washing, like we all know. Yes, so you wash appropriately under running water. By now you would have sought permission already to wash your hands at that particular place, because you can't just wash your hands anywhere, pour water anywhere in the client's compound. So you need permission to wash your hands onto that field. And the home visiting, usually you don't do just one client or just one household. So you have to wash your hands and prepare for the next house or the next client. Please don't forget that when you are doing the visit proper, you should do this hand washing before you pack your items into the bag. Yes. And home visiting is part of the duties of a public health nurse. So if you're a public health nursing student, you should do regular practices. You can do it in your hostels, in your houses. Practice how to use the bag, practice how to do the various visits, the special visits, the routine visits. and I think you'll be conversant with it. So definitely you do one during your licensure times, and in practice too you'll find it easier. So now he has packed everything. He's going to remove his apron. Let's see how he does it. So you should remove it such that you don't touch any of the outer surface, because as at now it is considered unclean. Yes, contaminated, the outer surface. So you only touch the inner part that is touching your uniform, and use it to remove and fold. And you fold the contaminated part inside, because you are going to put it back in your bag, and we don't want the contaminated surface to touch anything in the bag. Though you are going to clean it later on, you still have to fold it well. And yes, fold it well. So depending on the protocol that you've been taught, you may also put it in a rubber. All the used items, it's more appropriate to put them in a rubber before you put them inside your bag. So that's how you put it back to the chamber it belongs to originally. Yes, you have to pack everything. So by this time you have already informed the client that you are done, and you have already told the client of your next visit, or what the client should do. Maybe the client should go to the hospital or something, and you are packing everything. So you pick your Macintosh tool and fold the parts that touch the surface of the table or the floor inside. You have to fold that contaminated part inside, especially if you laid it was on the floor, because you don't want all the dirt or the dust to contaminate the things in your bag. Yes. Depending on how often you practice, you will find easier ways of doing it, of handling the bags and handling everything. So next, Boabin is done with everything, so he's going back to his facility or to the house for rest.